The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon to our Caltech alumni and friends of Caltech. It's my pleasure to welcome you to today's webinar, a conversation with the 2018 Chang Prize recipients. My name is Shayna Chabner, and I'm Caltech's Chief Communications Officer. We are delighted to have with us today Sean McKenna and Kyle Lakatos. Sean and Kyle are the first recipients of the Milton and Rosalind Chang Career Exploration Prize, the recent Caltech alumni who would like to explore careers outside of academia. The Chang Prize awards up to $65,000 in funding for career exploration projects. Sean and Kyle will present on their projects, which they have been working on over the past year. Before I begin, I'd like to go over some logistics for today's webinar. You can submit questions for Sean and Kyle by typing your questions into the questions pane of the control panel. You may send in your questions at any time during the presentation. We'll collect these and address them during a Q&A session at the end of today's presentations. I will now turn it over to Sean, who will discuss his project, exploring ways to tackle California's housing crisis. After Sean presents on his project, we will then turn it over to Kyle, who will discuss his project, Neighborhoods for Neurons, incorporating early childhood development health services into community centers. Following Sean and Kyle's presentations, I will kick off the discussion with Sean and Kyle and then invite questions from the audience. Without further ado, let's let Sean have the floor and talk to us about his project.
Thank you, Shayna. Thank you, everybody, for being here today. As Shayna said, my name is Sean McKenna, and I have been exploring ways to tackle California's housing crisis for the last about 7 months. I still have a couple months left to go in my project, in which I'm going to focus especially hard on communicating what I've learned today. So, of course, I just wanted to say thank you to the Caltech for creating the opportunity through the Chang Prize, and to the alumni for giving me the chance to speak today. So first, we're going to go through some existential musing about housing. What exactly is California's housing crisis? It's very important to define this problem, because once we know the causes, it allows the solutions to become self-evident sometimes, or at least less obscure than they were before. So as many of you are aware, thanks in large part to technological innovations that come from Caltech, California's economy is superheated right now. The Bay Area is by far the world's largest source of innovation. It's a magnet for innovative capital, and Los Angeles is not far behind. And this means that there's a lot of money flowing into California, being earned by the people who live here. But this money is not able to translate into the supply of new housing units, resulting in a shortage, by some estimates, of 3.5 million homes that drives up prices. California has very tight regulations on new building, and this is common across all of the United States, but it's particularly relevant in California because of the history of how we developed. Most of our built environment was created in the post-World War II landscape. And at that time, which isn't fully over, driving your gas-guzzling car home to your single-family house, plopped on a half-acre green lawn behind a white picket fence, was seen as a dream. It was the California dream and the American dream, and now our land use laws reflect it. And in California, we have these things that they don't have in most of the rest of the country, called the ocean and mountains. And for most of the last 75 years, if we ran out of room on one side of a mountain for more single-family homes, we would just build a freeway across the mountain and start building homes on the other side of it. That's how we got Lancaster and Palmdale and Santa Clarita in the Los Angeles area. That's how we got Tracy and Gilroy in the Bay Area. And many of these communities are still growing and still sprawling outwards, because it's the only place where it's legal for us to build new houses. Who has the power to change this legal structure? Local governments, who approve housing plans, housing developments, and housing redevelopments of all kinds. But another idiosyncrasy of California politics shows up here, Proposition 13. It's essentially rent control for your property taxes. And because local governments get so little property tax revenue, they're incentivized to approve commercial land use as opposed to housing land use. Big box stores don't have kids who need schooling, they don't have adult residents that need health centers and libraries, and they generate sales tax revenue that helps the city's bottom line. So for all of these reasons, it's just highly disincentivized to build housing in California. And when I say California's housing crisis, some people think that I also mean California's homelessness crisis. So I've had to reflect during my project on the relationship between the two. And I've learned that most experts consider homelessness to be intimately tied to the housing shortage, but also having unique characteristics that need to be addressed separately. The best analogy I've seen for homelessness is that the housing market is like a really cruel game of musical chairs. The odd person out isn't able to find a seat and ends up experiencing homelessness. And there may be several factors why that person was the most vulnerable participant to begin with, like mental illness, and those factors can get worse once they start to experience homelessness. To get them housed again can require building permanent supportive housing units for them, but to prevent them from falling into homelessness in the first place, we need to address the overall housing shortage so that there are more seats at the table for that game of housing musical chairs. So that's the perspective that I've brought into this project. And what exactly have I been doing over the course of it? Well, I've been trying my best to insert myself into the doers and the decision makers who have the potential to make a difference in the housing sphere. I interned with a nonprofit affordable housing developer, which means subsidized housing units, and I got to help out firsthand through their battle to get a 34-unit apartment complex approved. There were nasty letters in opposition. There was a website created by the opponents. There was testimony before the Los Angeles Planning Commission. And it was really just more shocking than I could have imagined and really opened my perspective to the battles that land use law creates for people who just want to help out their neighbors. I've also been trying to look for more innovative ways to build new housing units in order to address this shortage. I'm now a member of the Casita Coalition, which advocates for casitas, which means small form houses, such as ADUs, which is an accessory dwelling unit like a backyard cottage or converting a garage into a micro apartment. These are the kind of houses that can be built for $200,000 or $300,000 per unit, which is a significant savings over the full cost of a single family home with ground up construction. I also have been talking with a startup in LA that's using innovative construction and financing methods in order to deliver permanent supportive housing, which is the kind of housing that houses formerly homeless people, for about $125,000 per unit, as opposed to the $500,000 plus that it costs to build using traditional financing and construction methods. At really low costs like that, the developer is able to hire wraparound services for case management for their residents and still make a reasonable rent for an income for a person who is residing in the apartment complex that's no greater than a Social Security disability benefits paycheck. So that model seems very promising to me. At the state government level, I've attended a few hearings in Sacramento, and as someone who reveres democracy and parliamentary procedure, it's been really shocking to me how quickly decisions are made in public with there's barely any time left for robust testimony. But I've also been participating in the lobbying strategy for a couple of housing bills, and so that gives me a perspective into the rest of legislators' decision-making process and how they are or are not persuaded to arrive at certain conclusions on bills. I've been to several local government meetings for some of the hottest housing topics in California, like the Embarcadero Homeless Navigation Center in San Francisco and Stanford's campus expansion plan in Santa Clara County. Just like the affordable housing developer, these meetings can get incredibly contentious, and it's really valuable to see who has an organizational strategy and who doesn't with all the groups that show up to these meetings. One of the groups that does do a good job of organizing is YIMBY Action, which stands for Yes in My Backyard. It's a political action group that's based in San Francisco, where I am right now. I've been attending their meetings and following along with their actions. It's been really interesting to me how much their work is really just old school, door-to-door local politics. And on a lighter note, or sometimes a darker note, I've inserted myself into the strange world of housing Twitter. There's a lot of really loud tweeters out there. And it's honestly where a lot of ideas get produced, critiqued, and validated. There's a lot of really interesting thinkers on housing Twitter. So based on everything I've done, what do I think we can do to get out of this mess? Well, at a political level, there are certainly things that a centralized power could do. One of the most common refrains you'll hear on housing Twitter is to upzone, which means to make it legal to build more units of housing on land parcels. It's literally mathematically impossible for us to build the number of units needed, that 3.5 million, to fill our current housing shortage, because it's just illegal to do those under current zoning laws. So the real question is whether the upzoning that we need is going to end up coming from the state government or whether localities will choose to do it on their own. A couple more minor but still political solutions are using the Housing Accountability Act and streamlining for different types of developments. So I went to a workshop that taught us how to monitor localities to use the Housing Accountability Act, which prevents city councils from denying housing projects if they follow the city's guidelines. And I've been advocating for streamlining bills in Sacramento that take certain kinds of projects, like projects for teacher housing or nurses housing or just general affordable housing, and giving them an easier path through the land use entitlement process. In terms of tech, there are a couple of opportunities here, but it's actually a lot of people that I've spoken to as a result of this project are a little more pessimistic about tech than I might have expected. I've been interviewing builders who work on prefab and modular construction techniques, and there's general optimism, but nothing on the order of Moore's law revolutionizing how we do construction and how much it costs. I'm working on developing a civic engagement platform, like an app, that would be used for people who are interested in housing decisions or other local government decisions, but they don't have time or energy to go testify at a 5-hour-long Tuesday night city council meeting. Working with municipalities to get buy-in is going to be a very tough challenge for this. At the local level, at the grassroots level, things look a little more optimistic, and these are the kind of things that the people who are listening to this webinar could get involved with if they wanted to make a difference. I've been interviewing experts on community land trusts, which are a way of definancializing housing speculation by taking the profit motive out of housing by letting communities own land instead of individuals own land. And I think they're a very promising strategy. The YIMBY, or Yes in My Backyard movement, is gaining chapters all across the country for kind of local political action. If you join one of those chapters, you'll very quickly be caught up to speed on land use, on zoning, and what you can do to make a difference with your local decision makers. Even if you don't want to go out and join a YIMBY movement, it's still really important to know who your local elected officials are. City councils, city planning commissions, that's who approves housing. So if you care about housing, you should care about whose name is on the ballot for those positions. And if you want to get really creative, if you're a handy engineer type person, build a casita, convert your garage, build a backyard cottage for your favorite recent college grad, or see if you live on a lot where you might be able to convert your oneplex into a duplex. Those are the kind of things where people can make a difference on their own without waiting for a developer to propose something that addresses the housing shortage. So overall, unfortunately, the barriers to solving our housing crisis remain very high. A lot of residents show up to city council meetings in opposition to a project when all they've heard about it is a flyer in the mail or a post on Facebook saying that it will decrease their property values. I urge you to ensure that your informed voices are heard in civic debate. Another more political problem is the jurisdictional game theory of which cities make the move to approve housing. It's really tricky. A lot of the cities don't want to do it, and that's why I think upzoning is ultimately going to have to come from the state level. On a larger level, there are just some natural tendencies built into our political system to be small c conservative, to lean on avoiding change. And that's something that an acute economic realization, like what California is going through right now, is always going to be hard to deal with. In addition, at the federal level, we really view housing as a financial asset class, as a means for people to accumulate wealth. So there's always going to be an incentive for people who own that to restrict its supply. So maybe as a society, we need to rethink our tendency to use our houses as piggy banks. And finally, on a possibly pessimistic, possibly existential level, it's really hard to find good urbanism, or more broadly, examples of housing successes. What's the second most expensive housing market in the country? It's New York. They've got tall buildings galore. They've been upzoned, but the rent isn't that much cheaper than the Bay Area. Global centers of economic gravitas are always going to be expensive. So is California ever going to become as cheap again as it once was a few decades ago? Probably not. But can we all do something together to prevent things from getting worse and to make a difference in the lives of ourselves and our neighbors around us? Probably yes. That's what I'm continuing to work on. Thank you for listening to my presentation.
Thank you, Sean. And Shayna, are you muted?
Thank you. Thank you, Sean. I'd now like to turn this over to Kyle.
Great. Hello, everybody. Welcome. So I have a slightly different title than was introduced, and that's just the nature of sort of how this project has evolved over the last 6 months. And so I'm here today to talk about what we've been doing, looking at a community engaged and community design intervention to help support low-income families in San Francisco. And just to sort of give you a little bit of background on what this work sort of encompasses, I want us to start by looking at this graph that shows the relative amount per GDP that the US is spending on healthcare versus life expectancy. And it doesn't really matter what side of the aisle you sit on or if you have a side, but you can kind of see the US is definitely an outlier here in the way that we're spending money, but still having what is considered sort of a good metric of overall health as being sort of off on its own. We're about 50 in the ranking when it comes to life expectancy, even though we're #1 for healthcare spending. This number is also very similar to birth outcomes in this country. We're about 50 in birth outcomes when you look at other similar high-income countries. And this is kind of a startling statistic to think about. You may ask why this is happening, and the easiest answer is to sort of look at how we're spending money in our healthcare system. So if you consider a balance between what you could call prevention versus treatment, the US actually spends most of its healthcare costs on treatment. In fact, the CDC has estimated about 75% of all healthcare costs are associated with preventable chronic care. So things that would otherwise be preventable are being spent in the healthcare system. And one example I have of that is for obesity, actually costs about $250 billion per year to the healthcare industry. And so where does this all come down from? Why is this relevant to the project? Well, it has to do really with the fact that when we think about healthcare, what encompasses somebody's health goes far beyond what can be attended to in a 15 to 20-minute clinic visit. And so this model for healthcare has been studied for quite a while now, the socio-ecological model of health, but it really takes into consideration the fact that health happens beyond just the individual and just a quick sort of drug treatment. You have to consider things that are happening in their lives around them, their relationships, their communities, and ultimately the societies that they live in. This is sort of a system level approach to the way that we can view health, something that I think Caltech folk would be very attuned to dealing with, complex systems. And so I wanted to end this sort of picture here with a quote from a leading authority in this model, and it's the Robert Wood Johnson Foundation. They say, "Health starts where we live, learn, work, and play." And so this collectively is referred to as the social determinants of health. It's this idea that healthcare happens all over our lives, not just in the relationship between our provider and ourself. And so we wanted to think about how can we improve the lives of others using this model and this approach. And what does that mean for my project exactly? Well, just to give some background, I remember it was about a year ago I was initially targeted on social media to apply for this opportunity, and I didn't even know if it was real at first. But after a while, I ended up chatting with the physicians I've been working with at San Francisco General Hospital and said I had this opportunity. Is there anything that you think you'd be interested in working on? And they proposed to me this idea of preparing resources and materials for pregnant families and families with young children. And I said, that's great, that's good, but I know Caltech's going to need more than that to make a project and to get this funding. So I looked at some other work they've been doing. So this is the Department of Family and Community Medicine at San Francisco General, and they did a study actually particularly interesting. If you look at this data here, it looks at the prevalence of high blood pressure among different groups. And you can see that for Black people, specifically Black male adults, the levels of high blood pressure are very high amongst that population. And from a medical standpoint, this is not something that you can just deal with in a clinical standpoint. So they prepared this study and they did this community-based intervention where they trained barbers at Black-owned barber shops to have conversations with their clients during a visit about hypertension and controlling their blood pressure. And this is what's really remarkable. In about 32% of the clients in the initial study, where they just had a barber talking to them about this, they saw control of hypertension. And in another similar study where they had a pharmacist on site to help with medical or medicine reconciliation, they saw 90% control of hypertension and blood pressure. This is huge in the sort of medical world. So I knew that this sort of community-based level intervention was important, and I wanted to go ahead and combine those two together, and that's what the proposal ended up being. So I have a background in global health and education. So my experience is working in vaccine sciences and sort of understanding how do we bring something from a sort of idea into reality. And so I knew we had to start by undergoing a landscape analysis. And to start this work, I went ahead and interviewed 34 different folks who represented organizations, government officials, healthcare representatives, and academics across San Francisco and some across the US and similar urban environments to really understand, well, what is the need and what are the challenges associated with low-income families and children living in diverse urban environments? And I asked really 4 specific questions to sort of gauge at that, really looking at the main challenges families are facing, looking at the components of an ideal intervention that could be used, the ideal location for this kind of intervention, and then understanding what metrics and what evaluation tools we could use to really hone in and see if we were making significant progress in this field. Taking all that information together, we were able to identify common gaps and needs, and I was able to categorize them into 3 sort of subcategories shown there: socioeconomic, community and family, and healthcare. And this is based on, again, the Robert Wood Johnson Foundation social determinants of health model, which I'm going to show here in the next slide. So there's three layers, as you can see from the image on the right there, representing the economic and social opportunities, living and working conditions, and then at the very sort of center there, behavioral and medical care. And these, again, represent different layers of our healthcare model and our health system. And the common factors that we found were the challenges for low-income families and children are things that affect a lot of people in our country. So right now, as Sean mentioned, housing insecurity is very large. Food insecurity is very hard in the urban cities. For a lot of families, we're supporting immigration support and dealing with ICE and other political structures right now can be very difficult. When we look at the living conditions and working conditions, we find other challenges such as childcare services, building healthy parent-child diet dynamics, and a real big one that was universal across all of our stakeholders was this idea of navigation of resources. So I like to say San Francisco is actually a really great city to live if you're low income, but only if you have somewhere to live, because there's a lot of wonderful resources available. It's just that the housing is absolutely terrible. And then, of course, there's things that go on at the behavioral and medical care, such as oral health and nutrition, screening for trauma and abuse, and then developmental milestones. And so from that, we also gathered, we wanted to think about what the relationship was of what we could do in moving towards a community sort of engaged approach to health. So that's where the ECHO initiative sort of came from. It's bridging this gap between behavior and medical care and community health. So we're taking providers out of our sort of healthcare system, outside of the walls of the clinic, and moving them into community spaces. And I'll get to that in just a moment. I also wanted to mention we found what the ideal location was from these stakeholder interviews. And in San Francisco, we have a series of community centers known as the Family Resource Centers. Each of them acts as touch points for low-income families and children across our city of San Francisco. And according to their sort of governing website, the main thing that they do, providing services for families, is helping them navigate these systems that are available within the city of San Francisco. In addition to that, they also help with early child care development or early child care support, and they do this in a way that's culturally relevant. And to explain that a little bit more in depth, I'll go ahead and just show you this picture on the next slide. So this is a map of all of the family resource centers scattered across San Francisco. And you can see overlaid with the different, the darker blue represents higher populations of low-income families and children in the city. So you can see that these resource centers are actually set up in a way to help engage families that have different needs, because our city of San Francisco is very culturally diverse, and I can go ahead and say that the way that we talk about nutrition with a family in Chinatown is going to look very different than we would in the Mission, which is our sort of Latinx immigrant populations. You'll notice there's also a cluster of family resource centers up in the top right corner here of San Francisco. That's our downtown area, and we have a large homeless population that is aggregated in that area. So a lot of the services actually expand far beyond just early childhood, and they do serve really whatever the needs are of the neighborhood. And early on in this work, I want to just add another piece of context here. Is we also interviewed families to understand what services we could provide them. One of the sort of early questions was, well, if the challenge is navigation of resources, what if we just developed an app? Well, turns out the families aren't using technology the same way that you and I might be. They don't either have access to Wi-Fi, or their data plans don't support downloading large amounts of information, or they don't feel comfortable sharing their information on an app-based interface. And so this is really sort of the second point that I wanted to get across, that we have to listen to our target audience. So if we're trying to help low-income families and children, we need to understand that they're not using digital technology. So making a solution that's digitally based won't be adopted and won't be used by our families. So what do we end up doing? That's sort of where we're at now. So we're running a series of community health group workshops across different family resource centers that are going to cover various topics as requested by these different family resource centers. So most of them are engaged around early childhood development, and that includes pre and perinatal education, oral health and nutrition. Some fatherhood engagement has come up a bit. We're also starting to explore behavior and mental health conversations in these workshops. Another part of our intervention is we're not only bringing our clinicians out of the hospital, but we're also amplifying the voices already existent in these communities by providing a training to the families and to the staff members called health coach training. And this is something that was previously done with the barbershop intervention I mentioned earlier, but it's really a training that helps allow non-health professionals talk about health topics with their friends, their families, and their loved ones. And so we just actually finished our first health coach training last week, where we trained members from 4 different family resource centers in this methodology, and it was pretty well received. And the third sort of part of our intervention here is developing paper-based resource menus. So we're going to have maps that are physical handouts that show you all the common resources that families may use in a specific neighborhood of San Francisco. And on the other side, they're going to have some educational and child engagement based activities like you would see at a restaurant for the kids menu, except instead of food, you're going to get to know where the family resource center or the local library is. Again, this goes back to the idea that families aren't necessarily using digital technology, so we needed to find something that was going to work for them. And moving forward, we actually are starting our pilot launch this week with the family medicine residents going out into these community spaces, leading these health workshops. Over the next few months, we're hoping to show feasibility and measurable impacts. We've got a system of evaluations set up. Once we get that done, we're working with the governing body of these FRCs to look into expanding our efforts into other FRCs and then expanding into other health offerings. So again, I mentioned some of these FRCs focus on homeless populations or other low-income needs in the city. So we, as family medicine, kind of feel comfortable and ready to look into a lot of different fields of health that we want to be able to help connect people to in a community-based setting. And then hopefully, once we get this done, we're hoping to incorporate other specialties such as internal medicine, psychiatry, pediatrics as part of their residency training as well. And of course, I need to say thank you to everybody who's been a part of this process, including Milton, Rosalind Chang for putting this together, as well as the entire committee for taking a chance and selecting me to run through this, and just a list of all the wonderful people I've had the chance to interact with there on the right, including my wonderful mentor, Elizabeth Uwe Smith, doctor. She's been wonderful in all of this. So thank you to everyone.
Thank you. Thank you both very much for your presentations. I wanted to kind of kick off the conversation with you, Sean and Kyle. And stepping back for a minute, now that we've kind of heard about your work in more detail, and get an idea from you each independently, why you kind of wanted to take on this opportunity, were interested in this prize, and kind of wanted to explore this area, your areas of research, whether it was housing or community health. Sean, do you want to start?
Yeah, sure. Yeah, housing has just been something that I have become interested in over the past couple years, and it's funny when you meet people who are in the housing sphere. No one majors in housing. Some people major in economics at school, like I did. Some people major in data science. Some people are land use lawyers. Some people are like urban planners by training, or urban studies, and so everyone kind of like comes at this issue with a very different background. And so just meeting new people and hearing their ideas and their perspectives, and housing essentially is where the problem is. We have a housing crisis in California, so that's why it was really important for me to step aside from the work I was doing at a think tank, which is obviously very interesting and very kind of, Caltech-y in the sense of being surrounded by brilliant people and theorists all the time, and to just round out my understanding of the problem and the solutions in the housing space.
Great. Were you just working on this kind of effort, or independent of anything else, or kind of was it in tandem with other work you're doing either at the think tank or elsewhere?
Yeah, so at Rand Corporation, which is the think tank in Santa Monica where I work, I was working on some housing-related projects. For example, we were helping the government of Puerto Rico do research on how to recover from the hurricanes that they got hit by in 2017, and I was on the housing team for that. So after learning a lot about the housing market of Puerto Rico and how my kind of economic training prepared me in a way to analyze that, you just kind of take a step back and look up at the world around you, and you're like, wow, like the place where I'm living has a, kind of similar and kind of completely different housing problem. So wouldn't it be great if there were an opportunity for me to dive deep into this state's housing problem?
Interesting. And so that was your training here at Caltech, Sean, was in economics, is that right?
Yes, that's correct.
Okay, great. Now, Kyle, is my understanding correct that kind of you're in a place of transition for your career, and kind of that was some of the inspiration and idea to take advantage of this opportunity?
Yeah, completely. So I actually attended Caltech back in 2012 to 2013, and originally was in a PhD program for biophysics. After pretty early on, I realized that a academic career wasn't exactly my sort of forte. I went ahead and left with my master's and went up to Seattle, Washington, where I worked for a global health organization and did vaccine research for a while. And I really liked that because there was more sort of direct applicability of the science and the research I was doing. But after 5 years with PATH, I realized that there was something more I saw myself sort of moving towards. And health affects everybody. At the end of the day, we're all going to interact with healthcare either as a patient or as a caregiver in some form or another. And I knew that health was something I'd always had sort of an internal interest and drive for. So I was in the process of transitioning from a sort of translational research career into now a population health and medical career. And again, I was volunteering with the hospital at the time, and this opportunity arose. And I thought this would be a really wonderful way to explore this population level health, this community engaged health that I had envisioned and had seen work previously as something I could take with me throughout medical school and hopefully help build and develop throughout my career.
Great. Now, when you kind of dove into it, Kyle, were there aspects of it, the experience that surprised you, things that you found, or was it kind of what you were expecting?
Um, wow, I mean, there's definitely a lot of, I felt I was able to hit the ground running just because of my previous experience working in global health, which even though is called global health, a lot of the lessons you learn in that field are really how do we bring an idea to a community and how do we make it adoptable? How do we learn from the community what they actually want? And so it was really easy for me to transition into doing local community work in a sense. The challenges were getting my name out there and just asking, knocking on a lot of doors to get information and connect a lot of different pieces together. But it was also really sort of intellectually stimulating as well.
Yeah, I mean, it sounds like it. The opportunity to connect with so many people and so deeply on a topic is always kind of part of the Caltech ethos, right?
Mm-hmm.
Um, Sean, what about you? What was it what you expected when you kind of dove into this topic and issue of housing in a kind of more complete way, or kind of were there surprises for you?
Yeah, it's funny, it's just I've learned so much over the last 7 months that it's almost hard to remember what my expectations were going into it. But yeah, it's the kind of thing where I think it's really good to just as a person living our life, make sure we're drawing on a lot of like primary evidence and not just kind of like reading summaries that other people have written. So like what I was kind of saying during my presentation, like it's one thing to read in a newspaper article like, oh, there are a bunch of people who show up at a city council meeting and are angry about it. And it's another thing to see it in person and to literally see people like screaming at their city council members. And so, it's the kind of thing that like I said, like you read about it and you're like, oh my God, like that must be an extreme case. People, you know, okay. And then you go there and you're like, wow, people actually just get incredibly like mad about this. And so what Kyle has been saying today has really been kind of resonating with me too with the I really liked how he just said bringing an idea to a community, because uh, the extent to which people kind of use the phrase like community when they talk about communal decision making, like for building housing or not building housing, is something that I don't necessarily identify with as much. I think just as a young person and as someone who has, you know, moved from neighborhood to neighborhood within Pasadena, within Los Angeles, and highly mobile, I haven't sat down in one community for 30 years. And so that was definitely a surprise to me, just kind of how people's perception of their community is different, and then what lengths they'll go to in order to try to preserve it.
Interesting. Has this changed kind of your next steps? How have what you kind of learned and experienced over the last year influenced where you will go from here?
Yeah, it's interesting because it has modified but reinforced some of my convictions, which is that there's a lot of, economic research that goes on that just gets published in a journal and no one looks at it. But then there's a lot of economic research that people really voraciously need to hear and are waiting for. So a bunch of people right now are waiting for the UC Berkeley Housing Innovation Center to release this study on impact fees. And it's like the most, I've never heard of people waiting so much in anticipation for an academic study to come out. But it's, so there are really critical pieces, I think, of data and of, academic quality research that need to be put out there into the public discourse. So as I move forward with a career as kind of a researcher, knowledge generator, what's going to be really important to me, I think, is being affiliated, with institutions that are making an impact, that are writing stuff that people want to read, and also that are preparing it in a way that's very digestible for the average person. If it's the kind of research that is going to inform, people's political opinions, it needs to not be layered in so many nuances and caveats and assumptions that it becomes inapplicable to their lives. So that's kind of the conviction that I'm left with at the end of all of this, I'd say.
That's great. I think just listening to what you're saying, Sean, it kind of harkens back for me back to I think the inspiration behind this prize overall, really about bringing kind of Caltech's training and perspective of our alumni to the broader community. And I think kind of your ability both to understand from a research perspective, but then to have the time to look at it from a societal perspective, maybe provided some of that bridge that you're speaking to.
Yeah, definitely. One of my mentors at Rand, for example, not to promote Rand as well, but I think Rand and Caltech are both in the business of creating knowledge. And she produced this incredibly simple study that just says that for every $1 we spend on housing individuals who are experiencing homeless, the county government saves $1.22 of healthcare for picking up a homeless person off the street and treating them for whatever, and then dropping them back off on the street because they have nowhere else to go. So really simple, impactful stuff like that is probably going to be my focus going forward.
That's great. That's great. Kyle, what about you? How kind of has this work factored into your future plans, and has it shaped or changed them in your next steps?
Yeah, I think Sean kind of hit on this a little bit, what he just said, that there's really a need both to generate important, impactful, and meaningful data to show that the change is needed. But there's also a need to sort of formulate or aggregate all this data in a way that can influence policy. And that's something that I've been learning about a lot during this process, and looking at different funding mechanisms from governmental bodies, and trying to understand, well, how do we start to interplay and interweave these different funding bodies together to support each other in a way that hasn't necessarily been done before. And I think that this work that I'm doing right now of tying together two different bodies of funding, we're looking at the sort of Medicare, Medicaid system, as well as the Human Services Agency. Even though they're serving similar populations, they're not working together in a way that intuitively would make a lot of sense to really help support our patients and our sort of populations. And so moving forward, I definitely see myself exploring this a little bit further, sort of this interplay between public health and political impact.
Mm-hmm. Oh, that's great. I just one more question maybe before opening it up to the broader group for both of you. I'm just curious, what do you think is the most important thing that your fellow alumni and friends of Caltech should know about this experience, and what do you hope they take away from this?
I'll go ahead and just start. I would love to just pass the message that there are so many wonderfully complex systems that exist beyond fundamental science research that I think people who have brain capacity to research and think about should absolutely be looking into. So again, I kind of showed this complex healthcare model that we've got right now, and there's a lot of pieces in that. And I think that getting some really intelligent people to actually dissect and quantify what's going on could be really helpful in changing the healthcare system in this country.
That's great. Sean?
Yeah, I definitely agree with what Kyle just said. And I think a wonderfully complex system is local politics. And it's, it's just really important. I think a lot of us, especially in today's environment, get tied up in in national level news, or even thinking globally and acting locally, I would say. A lot of times we put all of our energy into and even maybe even our money into national level politics that happens once, an election that happens once every 2 years. Whereas at the local level, when we ask what does our community actually look like, where we're going to live, those decisions get made every week at city council meetings, and they get made just at a much higher frequency and with much more direct political input. So it's really important, I think, for everybody to be engaged, and to put out there what kind of vision they have for their own neighborhood. A lot of times, it's just the reactionary people or the fear mongers are the ones who put out their voices because they are afraid. And it's really important to have a voice of reason in public discourse, and I think Caltech people can be really good at providing that. So I would just encourage everyone to do it early and do it often.
I know I said I'd open it up. I have one more question for the two of you. It's interesting to me as you guys talk about complex systems. I mean, there is a kind of nice connection between both of your projects, right? They're not directly hitting the exact same topic, and you guys are approaching it a different way, but there is absolutely an interplay in that system overall. Throughout the last year, I mean, were you guys in connection with each other, or did you discuss the work you were doing?
Not too much. Kyle helped me with my taxes. That was great.
Yeah, I was really interested to see the work that Sean was doing, and I think hearing now the sort of work that he's done, I definitely think there's a good amount of, we definitely were hitting on similar topics, but again, like you just said, in sort of uniquely different ways, and it just kind of shows how vast and how much room there is for addressing these challenges.
Yeah, very interesting.
Yeah, I'd love to have you send me some article or reading about what you said, Kyle, about bringing ideas to the community and asking what they think of them, because that's not a way I had been thinking about the local government versus state control dynamic, but I think that's a really important perspective to bring.
Great. Well, at this time, I wanted to, open it up for conversation and questions from the broader audience here. So please, as I said at the beginning of the kind of webinar, if you have a question, you can submit questions for Sean and Kyle by typing your question into the questions pane of the control panel. You may send your questions in, and then I'll read them and kind of we'll move from there. So it looks like I have a couple ones, each kind of targeted for you guys individually. So Kyle, I have a question. Let's see. I've read about how primary care providers and preventative specialists in medicine are less valued financially and otherwise than interventional specialties, consider cardiologists, who mainly do preventative versus those that save you from a heart attack. Do you think that this plays a role in the USA's skewed spending on interventional medicine rather than preventative interventions?
Oh man, so I definitely thought about saying more of that in my presentation and I withheld. I can say that the current system of healthcare is kind of set up and run by business folks. And so with our insurance system and the way that we have to track, the way that it's very operations based. So every time you do something with a patient, you have to click a button and say that I can bill this, I can bill that. Turns out you can bill a lot of things in an OR or in a surgery, but you can't really bill that your 20-minute visit with your primary care provider was actually 45 minutes, and that you had to spend extra time making sure that your client understood what the recommendations you were giving them. There's actually a statistic that about 50% of people leave their primary care provider not knowing what or why they're getting these recommendations, because they're not involved in the healthcare decision. So spending more time with your client or your patient as a primary care provider can lead to better health outcomes, but that's not billable. That's not something that can be put on the insurance records. So yeah, I do think there's a sort of disconnect there, and it's a hard question because people who are sort of working and have huge adrenaline rushes as they're cutting somebody open or whatnot are in a very sort of high stress situation there, and the whole healthcare system is very expensive. And whether or not you think somebody who's doing a sort of orthopedic surgery should be making 5 times as much as somebody who's doing a primary care visit, that's still a very good question that some smart people need to start working on.
Do you notice or is anybody kind of pursuing these questions? Is there a space for this conversation?
Oh, the healthcare industry and sort of talking about all this has been a very long debate. You know, getting Obamacare was a 100-year-long process. Making any kind of radical change to the healthcare system, it's really just it's a politics thing. He started this, she started that, and getting everybody on the same foot and like agreed with each other is a very challenging thing to do. Actually, sort of this more idea of socialized medicine was originally opposed by doctors, and then it was proposed by Republicans, and then now it's proposed by Democrats. It's been back and forth for a long time. So there's people who have been thinking about and talking about it for a long time, but it's unfortunate how political and egotistical some of these things have boiled down to.
Sure. We can't solve all of the world's problems, right, in a year.
That's true.
Sean, for you, I have a question. Is there really a housing crisis, or is there predominantly an overcrowding crisis? Home lots in my city have been shrinking at a rate of 10% every 3 years. Home sizes are heading rapidly toward the size of a prison cell. Traffic times have been increasing. Crime rates have been increasing. These new homes are paying smaller amount of property taxes and leading to increased school and police costs. This is not scalable for keeping a high quality of life. Trying to increase housing density likely will make the overcrowding crisis worse.
So that kind of goes at what I was hinting at the end of my presentation, that it's really hard to say what would utopia look like. It's just very obvious that if you statistically look at the number of people per housing unit, California ranks second from the last, only behind Hawaii, which also has like even less developable land than California does. And so I think that is California's current built environment not meant to handle the number of people who are currently inhabiting it? Yes. And so there are 2 potential solutions. Either we upgrade our built environment in order to handle everyone who wants to live here, or we say to people, no, we're full, you can't live here. We've already got enough people. And so I tend to lean on the side of, if people want to move here because this is a wonderful, beautiful state, it's a diverse state, it's a state where, I have felt accepted and where I have met so many intriguing people, and where our global innovation leadership comes from our ability to bump into each other, in conference rooms and on the sidewalk and just, make really impressive things happen. So I err on the side of, we should improve our built environment in order to make possible the number of people who want to live productive lives here.
Great. Before wrapping up, then, I just want to ask both of you one more question, and that is, do you have advice for any of those who may be listening in or want to listen to this discussion at a later date and are interested in kind of the Chang Prize themselves? Any advice for them, either in thinking about the projects they want to or could pursue, or kind of how to fit the opportunity into your life?
One thing I've learned is that cold emailing people is a lot less successful than I anticipated it would be. Kyle said he got 63% survey response. He must have had a more targeted strategy than I did. I found it kind of difficult to like reach out to people as essentially a stranger and be like, I'm interested in what you're doing. Can I come on board or can I learn more? But on the flip side of that is, you find a few really good mentors who can act as a mediator and introduce you to, everyone who's in their network. So you don't have to go through the painstaking process of cold calling people in order to grow your own network. So that was something, I just kind of learned over the course of this project that I think would be important for anyone who envisions doing a project like mine in the future.
Great.
Yeah, I
Kyle?
would agree with Sean. That's a really good piece of advice, is like find a mediator to get you connected to somebody. That'll definitely help with those sort of stakeholder surveys that are going to be inevitable. My one piece of advice that I have is apply for the full amount of funding from the get-go. I unfortunately did not do that, and I mean, my project was a bit shorter. I'm actually finishing up this month because I'm starting medical school next week, and so I preemptively asked for a little less money. But you'll always find ways to increase the sort of offerings that you can do and ways that you can spend money when it comes to these kinds of things. So I would recommend, even if you're under budgeting, imagine that there's going to be more opportunities than you could ever imagine as things move forward. This project certainly has grown much further than I initially anticipated. And so we're exploring other funding mechanisms, so it's all great now, but just as a heads up from the get-go.
Well, thank you both. Thank you for sharing your journeys of career exploration with us today, and best of luck in your next and future endeavors. Good luck starting medical school next week. It's really our hope that Sean and Kyle's projects will inspire some of our audience here today and future audience to think about ways that they too can fearlessly explore their careers and broaden their horizons. Thank you to all of our participants for attending today's webinar. On behalf of Caltech, have a great rest of your day.
Thanks, everybody.